Is diabetes curable? There is no known remedy for type 2 diabetes. Be that as it may, it very well may be controlled. Furthermore, at times, it goes into remission. For certain individuals, a diabetes solid way of life is sufficient to control their glucose levels. That implies getting more fit on the off chance that you are overweight, eating well nourishments, and being more dynamic. What is remission? Of those individuals who needn't bother with diabetes medication, some find that their diabetes does switch with weight control, diabetes good dieting, and exercise. Their bodies are as yet ready to make and use insulin, and their glucose levels return to typical. Their diabetes is going away. If it's not too much trouble on the off chance that you are watching this video for the main time, kindly like this video and hit the subscribe button, click on the bell icon, so that whenever I drop a video like this, you will be informed. Much thanks to you. Current logical reasoning proposes that weight reduction is likely the main thrust for abatement in type 2 diabetes. As indicated by one hypothesis, the twin cycle hypothesis, when additional fat is saved in the liver because of weight increase, fat gathers in the pancreas and impedes insulin-creating beta cells. Many accept that diminishing fat in the pancreas through in general weight reduction is likely the driving force for remission in type 2 diabetes. The meaning of diabetes remission somewhat contrasts relying upon who you inquire. Scientists in the direct diabetes remission preliminary characterized it as having an A1C beneath 6.5%, the cutoff for a kind 2 diabetes finding, and stopping all diabetes prescriptions for in any event 2 months. Another gathering of specialists characterized remission as having an A1C underneath 5.7%, the cutoff for pre-diabetes, and suspending all diabetes prescriptions for in any event 1 year. Others accept that somebody can be disappearing while as yet taking metformin, as long as they have stopped different diabetes meds and brought down their A1C to beneath 6.5%. When talked about in diatribe, we are alluding to the principal definition, an A1C underneath 6.5% and stopping all diabetes prescriptions for in any event 2 months. Any way you characterize remission, any decrease in A1C as well as weight reduction is probably going to bring down the danger of long-term complications. Lower protection costs, expanded prosperity, and done taking prescriptions are likewise essential to many. While getting off all prescriptions isn't really the ultimate objective for individuals with diabetes, particularly given the advances in heart and kidney assurance with drugs like GLP-1 agonists and SGLT2 inhibitors, ceasing at least one meds may mean less side effects and financial savings. As an aside, getting familiar with cardio-defensive and kidney-defensive medication is an objective we put stock in for anybody with type 2 diabetes, paying little mind to glycemic well-being. Consider getting some information about these meds on the off chance that you have type 2. How have individuals with type 2 diabetes arrived at remission? Remission has been demonstrated to be because of standardization of the high fat levels inside liver and pancreas, and the best way to accomplish this is by significant weight reduction. There are 3 primary ways that individuals have placed their diabetes into remission: a low-starch diet, a low-calorie diet, and bariatric surgery. 1. A low-starch diet. One model for weight reduction proposes that diminishing sugar utilization diminishes fat stockpiling, reduces hunger, and expands energy expenditures. As per this model, the essential driver of weight gain is the insulin creation set off by utilization of starches. In any case, without going with weight reduction, a low-carb diet may not address the exhausted beta cells that are at the base of type 2 diabetes. At the end of the day, some individuals who bring down their sugar consumption follow a ketogenic diet, or keto diet, normally eating less than 60 grams of starch for every day. This powers the body to consume fat rather than starches for energy. In certain individuals, this quickens weight reduction, which can prompt diabetes remission. Others follow less prohibitive low sugar consumes less calories that despite everything take into consideration as much as 130 grams of starch for every day, i.e., a low-carb, high-fat, or low-carb, healthy-fat, LCHF, approach. A few analysts accept that sugar resistance must be individualized to accomplish remission in a given individual. For instance, one individual might have the option to support diabetes remission on as much as 100 grams of carbs every day, while another can just deal with 50 grams of carbs every day. 2. Low-calorie diet. An ongoing remarkable investigation uncovered a month ago, Diabetes Remission Clinical Trial (DIRECT) tried in the case of limiting calories expended would prompt diabetes abatement. Study members ate around 850 calories for each day for a quarter of a year, trailed by 2 months on a food reintroduction program, at last followed by a program for weight reduction upkeep, which included month-to-month registration and consolation to expand day-by-day physical action. Following 1 year, 46% of the members on the low-calorie diet had accomplished abatement. In correlation, just 4% of individuals who adhered to standard diabetes care rules went into remission. Diabetes remission was firmly identified with weight reduction. Kinds of remission. Partial remission, when blood glucose level is lower than that of a diabetic for over a year without medicine. Complete reduction, is 1 year or a greater amount of typical A1C and fasting glucose levels without utilizing diabetes medicine, oral hypoglycemic medications. At the point when you have total remission, you despite everything get tried for high glucose, hypertension, elevated cholesterol, and kidney and eye issues. You do normal foot checks. Delayed reduction, is 5 years or a greater amount of typical A1C and glucose levels without utilizing diabetes medication. You may have lab tests less regularly. In any case, you must be going for medical checkups for the essential organs that be influenced by diabetes. This by and large methods lessening A1C to the degree of somebody without diabetes under 6.5% and either killing diabetes meds out and out or constraining prescription to metformin. Remission is no doubt in the beginning phase of diabetes or after a major weight reduction. It can likewise occur after bariatric surgery for weight reduction, which can trigger solid changes in the body's insulin framework. Remission is less likely in the later phases of diabetes, in light of the fact that the body may gradually lose its capacity to make insulin after some time. Regardless of whether your diabetes is leveled out or going away, the keys to keeping high glucose down are weight control, workout, and a diabetes-sound eating routine. Control your diabetes. If you have any questions you want me to answer about diabetes or your health, please leave a comment below. Thank you. You will probably take the necessary steps to keep your glucose in your objective range. You may go into reduction, or you may not. Remember these rules. Eat a blend of nourishments. Starch raises your glucose higher and more rapidly than some other supplement. Eat nourishments with protein, fat, and fiber, they don't raise your glucose so much. Control your carbs. To assist take with charging of your diabetes, oversee how much and what sort of starch you eat. Spread carbs consistently. Stay active. At the point when you are dynamic, your body utilizes sugar. You can utilize movement to help bring down your glucose and deal with your diabetes. Exercise additionally can assist you with getting in shape and remain at a sound weight. Move more. In the event that you use medication, you may discover you need less of it when you increment your activity. After some time, practice encourages a few people quit utilizing medication. Know your A1C. The A1C test gives you your normal glucose level over the couple of months before the test. For the most part, A1C is checked at any rate 2 times each year. Talk with your PCP about how regularly you ought to have this test. For more data about how to oversee diabetes, I left a link below to guide you. Thank you for watching my video and see you in my next video.